Immunity. Immunity can either be innate or acquired. Innate is also called as native immunity. Innate immunity provides the first line of defense against infections. It is the resistance to infections that an individual possesses by virtue of his or her genetic and constitutional makeup. It is not affected by prior contact with microorganisms or immunization. Innate immunity may be considered at the level of species, race, or individual. So, the first one under innate immunity is the species immunity. Species immunity refers to the total or relative refractoriness to a pathogen shown by all the members of a species. This immunity is something a person obtains by virtue of being a part of human species. It is due to physiological and biochemical differences between the tissues of different host species which determine whether or not a pathogen can multiply in them. The second one under innate immunity is the racial immunity. Within a species, different races may show differences in susceptibility to infections. And the third one under innate immunity is the individual immunity. Individual immunity is the difference in innate immunity exhibited by different individuals in a race. It is well documented that homozygous twins exhibit similar degrees of resistance to lepromatous leprosy and tuberculosis. Such correlations are not seen in heterozygous twins. Factors affecting innate immunity. The first one is age. The very young and the very old are more susceptible to infectious diseases. The second one is hormonal influences. Endocrine disorders, for example, diabetes mellitus, hypothyroidism, and adrenal dysfunction, are associated with enhanced susceptibility to infection. The third one is nutrition. Both hormonal and cell mediated immune response processes are reduced when there is malnutrition. Mechanism of innate immunity. Epithelial surfaces. The skin and the mucous membrane covering the body part protect against invasion by microorganisms. The skin frees itself from the bacteria deposited on it, but its reactions are different to bacterial flora. Resident flora are not easily removed by washing. The mucosa of the respiratory tract has several innate mechanisms of defense. Cough reflex is an important defense mechanism of the respiratory tract. The cilia on the respiratory epithelial cell propel the food particles upwards. Mouth is constantly bathed in saliva, which has an inhibitory effect on many organisms. The particles deposited in the mouth are swallowed and subjected to action of digestive juices. The high acidity of stomach destroys most of the organisms. The conjunctiva is freed of foreign particles by the flushing action of the lacrimal secretions. Tears contain antibacterial substances which are active against gram-positive bacteria. On the other hand, flushing of urine eliminates the bacteria from the urethra. The acidity of adult vagina makes it inhospitable to many pathogens. The other mechanism includes antibacterial substances in blood and tissues. The first one is beta-lysine, which is active against anthrax and the related bacilli. The second one is basic polypeptides such as leucines from platelets. Then we have acidic substances such as lactic acid found in muscle tissues. Lactoperoxidase in milk possesses antibacterial properties. Interferon helps in protection against acute viral infection. The third one is microbial antagonisms. The skin and mucous surfaces have resident bacterial flora which prevent colonization by pathogens. The fourth one is cellular factors. Phagocytic cells ingest and destroy the microorganisms that invade blood and tissue. These are microphages and macrophages. A release of lymphocytes called the NK cells, which are the natural killer cells, are important in the defense against viral infections and tumors. The natural killer cells are activated by interferons. The fifth one is inflammation, tissue injury or irritation initiated by entry of pathogens or other irritants leads to inflammation, which is an important non-specific defense mechanism. The arterioles at the site constrict initially and then dilate, leading to increased blood flow. The sixth one is fever. A rise in temperature following infection is a natural defense mechanism. Fever stimulates the production of interferon and aids recovery from viral infections. The seventh one is acute phase proteins. Infections or injury leads to sudden increase in the plasma concentration of certain proteins called the acute phase proteins. They enhance the host resistance, prevent tissue injury, and repair of inflammatory lesions. Now let's see what is acquired immunity. The resistance that an individual acquires during life by recognizing and selectively eliminating specific foreign molecules is known as acquired immunity. Acquired immunity has four characteristic features: antigen specificity, diversity, immunological memory, self or non-self recognition. It is also known as adaptive immunity as it represents adaptive response of the host to specific pathogens or antigens. It involves active functioning of the host's immune, leading to synthesis of antibodies and production of immunologically active cells. It sets in only after a latent period. During the development of active immunity, there is often a negative phase during which the level of immunity may be low. Once developed, active immunity is long lasting. Active immunity is associated with immunological memory besides development of humoral and cellular immunity. Active immunization is more effective than passive immunization. The second one under acquired immunity is the passive immunity. This is the resistance that is transmitted passively to a recipient in a ready-made form. Here, the recipient's immune system plays no active role. There is no antigenic stimulus. Instead, preformed antibodies are administered. There is no latent period. There is no negative phase. The immunity is transient, lasting for days and lasts for a brief period of time. No secondary type response occurs in passive immunity. There is a factor called immune elimination that limits the usefulness of repeated passive immunization. Passive immunization is less active than active immunization. The main advantage of passive immunity is that it acts immediately. Under types of active immunity, we have natural and artificial active immunity. Natural active immunity results from either a clinical or an inapparent infection by a microbe. Majority of adults possess natural active immunity to poliomyelitis. There is lifelong immunity for viral diseases like chickenpox and measles. Then we have artificial active immunity. It is the resistance induced by vaccines, for example, bacterial vaccines. Live BCG vaccine for tuberculosis, killed cholera vaccine, subunit typhoid antigen, bacterial products, tetanus toxoid. Examples of viral vaccines: live oral polio vaccine, killed injectable polio vaccine, subunit hepatitis B vaccine. Killed vaccines are less immunogenic than live vaccines, and the protection lasts only for a short period. They therefore have to be administered repeatedly. At least 2 doses are required for the production of immunity. The first one is the primary dose, and the second one is the booster dose. Types of passive immunity: we have natural and artificial passive immunity. First one is natural passive immunity. It is the resistance passively transferred from the mother to the baby. In human beings, infants' maternal antibodies are transmitted through placenta. Human colostrum, rich in IgA antibodies, protects the neonates. By active immunization of mothers during pregnancy, it is possible to improve the quality of passive immunity in infants. The second type is the artificial passive immunity. It is the resistance passively transferred to a recipient by administration of antibodies. The agents used are hyperimmune serum of animals or human origin, pooled human gamma globulin, and convalescent sera. Passive immunization is indicated for immediate and temporary protection. It is used for suppression of active immunity. The last one is combined immunity. Combination of active and passive methods of immunization is used. For example, protection of patient with tetanus prone wound.